Hi, I'm Eric Rabel. I'm a medical editor on DocWire News, and I have with me today Dr. Payal Kohli. She's a cardiologist who works at Cherry Creek Heart in Denver, Colorado, and is also a local NBC affiliate health expert for their NBC affiliate out there. It's good to have you talking with us today. Thank you for taking the time.
Thanks for having me.
So I wanted to just go very quickly through a couple questions that I had. Obviously, the thing that's on everybody's mind in the country and in the medical community probably is the COVID-19 pandemic. Everything in the last month or so has revolved in some way around it, and cardiology is obviously no exception. We're just reaching out to as many people as we can to get different perspectives and different specialties about what's going on. And I have just a couple questions here that I guess I'll start running through. So the first one is the COVID-19 pandemic has been hitting states with differing levels of intensity, different infection rates, and so forth. And I was just interested in what your experience on the ground may have been from your seat so far.
So we've been relatively lucky here in Colorado. And let me explain to you, we have had a very unique experience with COVID-19 as well. So when it first hit our state, it actually had an R0, a reproductive number of 3 to 4. So that was even higher than what was reported in China. And it was spreading quite quickly. But with social distancing, we were quickly able to bring that R0 actually down to close to 1. And we went from having exponential growth to really having linear growth. But some of the challenges that have been unique for us here in Colorado are first that our first case actually occurred up in the mountains. So our hotspot was the mountains. And that's because, as you can imagine, Colorado is a big ski destination for a lot of visitors from a lot of international sites. And the first case was actually thought to have come from Europe because the person who tested positive had actually visited Italy the week before. And so we thought that the case came from Europe. So that was an interesting challenge because just like New York City, we have a lot of visitors from all over the world coming, especially to our mountain parts of Colorado. And that's really how it spread into the community. A very different pattern from what you usually see in cities where it starts in the urban location and then really goes out more rural, but this was almost backwards. The other interesting observation in Colorado was that because of being at altitude, we actually have less oxygen in the air. And given that this is a respiratory virus and that people can have problems with oxygenation and need ventilators, that was certainly a concern for us as well, particularly again up in the mountains where the altitude is even higher, so the amount of oxygen in the air is even lower. And what we saw was that we did have a number of patients that needed to be quickly transferred from the mountains down to Denver, which is still a mile high, 5,280 feet, but not quite as high in as the mountains, which is 8,000 to 9,000 feet. And that seemed to improve their oxygenation a little bit as well. So 2 unique challenges for us here in Colorado. Currently, we have relaxed our stay-at-home order to what's called a safer at-home order because we've had so much success with really flattening the curve. Having said that, however, I do have my concerns that it's premature because our testing is just not where it needs to be. So we're doing about 2,000 tests a day, which is essentially 0.04% of Colorado's population. And as you've seen in many of the models, including the model from Harvard, we need to be testing about 2% of the population. So we need to do 50 times more testing than what we're doing by early June in order for us to really stay on track with a safe blueprint to open up the state. So I have concerns that some of our challenges may lay ahead, but it has certainly been an interesting ride so far.
Sure. That kind of actually, maybe you kind of answered it in that question, but my next question was just what are some of the biggest challenges and maybe some of the lessons that you're learning as you go through fighting the pandemic in your space?
I have to say this has really been a once in a lifetime sort of a learning opportunity, both with respect to challenges and with lessons. And the challenges have been huge. And in medical school, the first thing we were taught was about the importance of the human touch in healing, looking your patient in the eye, holding their hand, and the physical exam to really understand what's wrong with them. And that is not something we have the luxury to do during this type of pandemic. We were taught to make medical decisions based on testing and the outcomes of testing, but with lack of access to testing and lack of accurate testing, that's also been thrown out the window. And we've been told to only use therapies that have strong clinical trial evidence, including randomized controlled trials. And yet in this pandemic, we're having to rely on anecdotal evidence or clinical trials without placebo arms with small sample sizes to make clinical decisions. So I would say pretty much in every way, this has really thrown the rule book out the window, this pandemic, and that's just been a challenge to practice medicine differently. And then there's also been personal challenges. You know, the mental health of physicians. We recently heard about a physician who took her own life. You know, it's been really hard. And thinking about not having enough PPE, thinking about our risk to ourselves, to our families, those are not challenges we had expected to have as practicing physicians in the United States. So I think all of those have really been humbling, so to speak. But I think they've taught us some important lessons. And in my mind, I have a few lessons I take away. The first is that preparedness is paramount. So at many hospitals, I think if they had stockpiled some of this PPE and the ventilators like they were supposed to for emergency preparedness, perhaps this could have been attenuated some of these effects. The second effect is really that necessity is the mother of invention. And I think that's an important lesson as well, that even though it's been really, really hard, I think it's taught us to innovate, to think outside the box, to find creative solutions. And then the final lesson, and it's more of a silver lining actually, is just how much in a way it's brought health to people's minds, to the forefront of our patients' minds. Prevention has become really important because people have started thinking about washing their hands and vaccines and all the things they didn't think about before. And then the physician community and healthcare community has really come together as well. You know, they've bonded across international borders and found ways to communicate that I found really amazing.
Great. So what, if anything, maybe has surprised you most about the way that the virus itself presents in patients?
I have to tell you, I've never seen a virus like this one before, and I call it the wild card virus because it really can do anything. So you have all the way on this end of the spectrum is people who are asymptomatic; they don't even know that they have the virus, and they're feeling just fine. And then on the other end of the spectrum, you have people, you know, who quickly crash and end up in the intensive care unit and die. And in the middle, you have a whole host of presentations. So this can affect your eyes, it can affect your taste of your taste or your smell. You know, it can cause strokes, it can cause heart attacks, it can cause kidney failure, it can cause blood clots. And we don't understand why someone's going to be on this end of the spectrum and someone's going to be on this end. We don't understand why children are relatively protected, why pregnant women are relatively protected. So I think the virus has really humbled me in the sense that it's presenting in such a wide spectrum in a way that doesn't follow clear patterns, that we are still yet to uncover a lot of the pathophysiology. And it's shown us that novelty can happen, that, you know, we can go in a few months from having a normal life to having complete disruption of our lives when genetic recombination happens and a new virus emerges. So the virus has really surprised me because it can do almost anything, and it keeps presenting new surprises every single day, which I think will pose some challenges for us learning how to combat it effectively in the future. But
Okay. So one of your specialties obviously is cardiology and specifically preventive cardiology. So what can one do to give themselves the best chance of improving overall heart health so that a potential COVID infection might not become something worse?
I think this is a really important question. And one of the things as a cardiologist that has really struck me about the virus is that the risk factors that keep emerging. So if you look at the 5,700 hospitalized patients that were admitted to New York City hospitals, this was a cohort published in JAMA. What you see is that the most common comorbidities are actually cardiovascular comorbidities like hypertension, obesity, and diabetes. What you're not seeing is such an overrepresentation of lung conditions like COPD, asthma, or obstructive sleep apnea. So even though it's a lung virus, in a way, it almost makes the ones that have heart disease do a lot worse. And so to me, that emphasizes even more how important prevention is now more than ever. And certainly we have to think outside the box about how to prevent heart disease at a time like this, because in an era of social distancing and in an era where we're trying to avoid blood work, you know, going to the doctor, getting out of the house, a lot of those can present significant challenges. But I think it's really important to remind ourselves that by investing in our preventive health, we're not just improving our chances of having a heart attack or a stroke or, you know, heart failure, but we're actually improving our risk if we were to contract the COVID infection. And I think that the nice thing is a lot of patients have really realized that, and a lot of people are paying attention. The other wonderful thing that's happened with people staying home is that sodium content in people's diet has started to go down. So people are cooking more at home rather than eating out. And so they're generally tending to eat better. And, they're generally also tending to pay more attention to trying to get enough activity during the day, because a lot of them don't have their usual busy routines where they're running around. So a lot of people are focusing on exercise as well. So I'm optimistic that this might help us to rethink about how we treat prevention, so that it's not a once a year doctor's visit, you check all your boxes, you check your blood work, but it's an everyday goal. It's something we talk about every day and think about every day. And I think that that's happening. So I'm excited about that opportunity.
Great. So the last question I have here is what effect do you think the pandemic might have on medicine at large, and maybe cardiology in particular? You probably hinted at some of these things in your previous answers. But.
Yeah, I think there's many different effects it could have. So certainly in terms of the medical effects and the medical comorbidity, I recently wrote a paper in Circulation that's going to be published next week, which talks about surfing the waves of the pandemic. So we talk about the waves of the pandemic and the curves. So that first curve that we're all trying to flatten is the immediate effect of the virus. And so that's the mortality and morbidity related to people catching the virus and getting sick. But the problem is, as we're trying to flatten that curve, we're actually steepening all the other curves, because we've seen data out there that people are not coming to emergency rooms for acute coronary syndromes, for strokes, for other emergency situations, because they're afraid of going to the hospital. Or if they come to the hospital, there's an unusually long delay in the ambulance or in the resources that they get. And sometimes there's a diagnosis bias. So if they present to the hospital with shock, people automatically think that it's COVID, whereas it could be valvular heart disease, or it could be, cardiogenic shock from an MI. And so for a lot of reasons, people are not getting timely care as they should for their urgent conditions. And that's that second wave that's happening. So first wave is the virus itself. Second wave is the effects of delaying treatment for acute or urgent conditions. And then the third wave is the prevention wave, I like to call it. And that's where putting off treatment for things like hypertension, diabetes, heart failure, atrial fibrillation, sleep apnea can really have long-term effects. And so what we want to do is really make sure that as we flatten that first curve, we're also continuing to flatten the other curves, because the last thing we want this pandemic to do is to really have a casualty of guideline-directed medical care, which has been such a strong part of cardiology and medicine in general. So I think the first impact that this has had on medicine and cardiology is really on guideline-directed medical care. Cancer patients are not getting their treatments, people are not getting into the hospital, and I think we have to focus on that to really make sure that it doesn't become an ongoing casualty. But on the positive side, I also think it's had some positive benefits on medicine and care in general, in the sense that it's allowed people to access care from their homes, which makes it not just more accessible, but also more affordable, because there's a lot less, overhead. It also makes it in some ways more personal, and I miss seeing my patients, touching them, shaking hands with them or giving them a hug. But at the same time, I really do love the idea of seeing them in their homes with their families and their pets. It gives me a way to understand what their social situation is much better than something they could explain to me in an exam room. So that has been really positive, and I hope it continues to stay throughout, that even after this pandemic is over, we continue to have a way to connect with people in their homes in a way that we hadn't done before. And I've also said this before, but this pandemic has really improved innovation in healthcare and healthcare delivery tremendously, such that we have now figured out how to fast track vaccines. We've figured out, how to use computer models and science and artificial intelligence to find solutions to problems. And we've done this all in a span of a few weeks, things that would normally take months to years to decades to happen.
Great. So that's everything I had. And you covered a lot of ground there, obviously, with cardiology and medicine. So I wanted to really thank you for just running through all that. It's a lot of what we hear on the news every night. And it's great just to, hear it aimed at our audience. So with that, I will probably let you go. And I wanted to thank you again, Dr. Kohli, for taking the time to speak with us. And have a great, pleasant day.
Thank you so much for having me. My pleasure.
You're welcome. Take care.